boob hurt. Oh, I just finished breastfeeding, but nothing's coming out. Is it hot to the touch? It's hot to the touch. I got chills. Why do I got a fever? Oh, I don't feel good. Oh my gosh, it's so painful. Does that sound familiar? Y'all, that's mastitis. Mastitis is a breast infection, and in this video, I'm gonna talk about possible causes, signs and symptoms, what you can do to treat it at home when you need to seek a provider, and little tips and tricks on how to prevent it. Hey y'all, my name is Joanna Callaway, and in my channel, I talk about faith, motherhood, and culture, and finding your identity amongst all those things without having to sacrifice your role as a caretaker. As a mom and a nurse, I have a lot to learn, I have a lot to teach, so come on this journey and let's learn together. Mastitis is a breast infection, and it usually happens when you are breastfeeding and you are in your first 6 weeks postpartum. That's when it typically happens. A blocked milk duct is when your milk doesn't completely drain from your breast. Now think about your breast and think about all the ducts. We'll just, I don't know, use a metaphor of rivers or something. So you have the river flowing, right? And the creeks and everything is going to the nipple and going out into their baby's mouth. And then all of a sudden, it gets blocked, right? It gets blocked by a boulder, I don't know. And it's just holding all the milk back, but your milk keeps producing, which means that it's very hard, and you can tell which area is blocked because there is a hard lump in there. Your boobs are constantly exposed to bacteria if you really think about it, because you have your baby's saliva from breastfeeding, you have the moisture from probably your milk leaking, and your bra being super moist. And let's not forget, on top of that, you are sleep deprived because you have a newborn. Symptoms include swollen breasts that may be hard or hot to the touch, skin redness, a lump in the breast sensitivity or unexplained pain or burning during feedings, a fever of 101 or higher, body aches and pains, exhaustion, or flu-like symptoms. I had it within the first 3 months, and I had it 2 times, mainly because I'm pretty sure I was exhausted and I had cracked nipples, and it was just super, super painful. Like, I would cry because I honestly did not want to breastfeed him because it would hurt so bad. It hurt. My breast was it was hot to the touch, actually. It wasn't warm to the touch, it was hot. It was hot, it didn't get red. It was hard, super hard. My fever jumped up from 100 to 104 within 30 minutes, and it was insane. I had flu-like symptoms, and on top of that, I was taking care of my newborn. That was not fun at all. The risk factors are if you have cracked nipples, tight-fitting bras, improper nursing technique, or the baby not latching. You have lots of stress, obviously. You're exhausted and you have poor nutrition. Those are the risk factors. A complication of mastitis is an abscess from that milk duct. An abscess meaning pus. And when that does happen, you actually need to get it surgically drained. Whenever I had mastitis, I took a really hot shower and I just massaged the crap out of that clogged duct. And you can feel it, it's a knot on your boob. And it hurt. Take a Tylenol maybe beforehand, and before you hop in the shower and you massage your boob, because it's just probably gonna be better for you pain-wise. But I just felt the duct wherever it was and massaged the crap out of it to loosen it up and have it drain. You want it to drain out of your nipple. You'll want it to drain out of your nipple. Increase feeding. Even though it's gonna be painful, increase feeding as much as you can. So when your baby's hungry, put them on the affected breast first. Put them on the breast that has the clogged duct first, because the baby's hungry and they're going to latch and they're going to suck stronger, okay? They are natural suckers to your boob and they can take out whatever the massage can't. Try different positions as well, because maybe that also might be the cause of a clogged milk duct. You're just in a bad position or the baby's not latching. Rest as much as you can. I know that that's easier said than done, but try to rest as much as you can, because you're sleep deprived, you're exhausted, your immunity is just going down. Keeping your boobies clean. Okay? You gotta keep the boobies clean, because if you don't keep it clean, bacteria is gonna build up. And let's keep our bras clean. Let's change our bras whenever we need to. If your bra is soaking, take it off, change it into a new bra. Don't have tight fitting bras when you're breastfeeding or you're going through this. If you're having nursing pads, change them out regularly. Don't let your nipples just sit in there and sit in the moisture, because bacteria is going to enter into your nipples and into your boobs, to your milk ducts. We don't want that to happen, all right? Keep your breast pump clean, keep it sanitized, and it can prevent future infections from happening. Do not hesitate to reach out to your OB and your midwife if you have any concerns about mastitis or a clogged duct, because they are there to help you. They are there to take care of you. And if you're having any of those symptoms, give them a call, let them know. You may need to start on antibiotics. And that's a lot better than going into surgery and draining out your boob. Have you ever had mastitis before? If so, let me know your experience, comment below. And if you like this video, click that like button right here, bing, and subscribe to my channel right here. And I'll see you on the next video. Bye. Go ahead and, yeah. I got a fever. I got a fever. I got a fever and I need more cowbell. Let's backtrack. It's not. So, take a cow.